One of the most overlooked cornerstones of preventative health is the wellness exam that takes place or should take place on an annual basis every year. This is one of the best places to start your health and wellness journey. Today we'll talk about what an annual wellness exam is and what happens during these appointments, why these visits are so important, and why I recommend them for everyone. And lastly, we'll discuss some of the most common reasons why people do not get them. And I'll also give some brief insights, guidance, and helpful hints for each of those reasons. But overall, I want you to remember that I am here as a resource for you. So if I miss anything, if you have any questions by the end of this video, leave me a comment below. While I cannot give you medical advice, I can at least try to help. But per usual, I got excited. I just jumped right into this video, but where are my manners? My name is Dr. Knox. I am a DNP, Doctor of Nursing Practice, and I am wildly curious and passionate about all things health and wellness. If you are new here, take a second to click on that subscribe button. It really does go a long way in helping my channel to grow. And if you are coming back, if you have been here before, welcome back. But let's get into today's video. So what is an annual wellness exam? Well, an annual wellness exam is an in-person appointment with your healthcare provider to focus on your health. It's an opportunity to gain insight to what your current health levels are. It's an amazing opportunity to gain insight to where you are currently with your health. It's also an opportunity to participate in some screening tests if they apply to you. The goal is to identify potential health issues early and help you start to build better lifestyle habits. Your healthcare provider. I use the term healthcare provider, not your doctor, because not everyone that performs a annual wellness exam is a physician, is a doctor. They are oftentimes performed by NPs and DNPs like myself. So using the term healthcare provider just encompasses a wide variety of different types of healthcare providers. But nonetheless, your healthcare provider will typically get a very full picture of your overall health, including things like what types of medication you take that are over the counter or prescription, or even recreational. They'll get your height and weight. They'll get information on any past surgeries that you've had, as well as any family history of healthcare conditions. And the list goes on and on. They will likely order a standard comprehensive lab test. This is where you go and get your blood drawn. They are typically checking things like your blood count, your kidney and liver function, your electrolytes and vitamins, your cholesterol levels, checking like things for diabetes or pre-diabetes, and so on and so forth. Typically, they will take a moment to review your immunization record to make sure that you are up to date on all of your immunizations, your vaccinations. They will also order the appropriate screening tests. These are things like mammograms, colonoscopies, and so on. They'll order and make sure that you're up to date on your vision screening. And this is an opportunity to even do something like an STD screening. And they will also do something called a physical exam. Now, depending on the provider that you go to, some people I have seen do more of a targeted physical exam. And by targeted, I mean they focus on listening to your heart and lungs, maybe looking into your eyes, but nothing too detailed. While there are other providers who will do something more along the lines of a head-to-toe physical exam. And when I say head-to-toe, it's kind of what it sounds like. This is where you go and they check your eyes. This is where they shine the light in your eye, and they also have your eyes following along and tracking what they're holding in their hand. They'll check your ears, your nose, your mouth. They'll feel along your neck. They will listen to your heart and lung sounds from the front and the back. They'll check your abdomen. It's literally going down step by step, head to toe, to make sure that everything looks to be functioning well. And if there are any things that are out of the norm, that they are paying attention to that and making a record of it. So it can get up close and personal. So prepare appropriately. As a side note for my women, some providers, some primary care offices will offer a pap smear or a vaginal exam with your annual wellness visit. There are some offices that will not, and you will have to schedule a separate appointment called an annual well woman exam. Either way, as a woman, you should be getting an annual wellness exam and an annual well woman exam every single year. So ask in advance to your particular primary care office to see what you're actually showing up for. As a sidebar, typically when it comes to blood tests, some providers will give you blood tests at your annual physical exam, and so you are not going over any blood test results at that appointment. You will come back and go over those results. There are providers who provide the option of getting your blood test done in advance so that when you come to your annual wellness visit, they can go over the lab results with you during that time. So it's one visit versus two. So that's another thing to ask your particular healthcare provider's office. This visit is typically covered in full by most insurance companies. However, these visits are available for a cash price at certain locations. So why are these exams important? Most importantly, because early detection is so critical for your overall health and wellness. When providers are able to detect things like abnormal blood counts, vitamin and mineral deficiencies, kidney and liver problems, abnormal heart sounds. Finding these things early really does make a huge difference in your overall prognosis and what your treatment options and next steps are. A lot of these things being detected early can save you a ton of money, time, and frustration, short and long term. Many people will look and feel fine, but I always tell people, you don't know what you don't know. If you feel fine and you feel like you're in optimal health, go and get the testing done. Go and get your blood results done. Go and get your annual wellness exam and have proof to back that up. Because honestly, once symptoms arise, whatever is going on is typically already progressing. We want to catch things early before they get worse and potentially spiral out of control or cause you just a lot of headaches and feelings of unwell. Providers also want to prevent a lot of these things from happening in the first place. For example, with diabetes, it's something that we can track through your blood work. The labs that we're looking at, typically we monitor something called an A1C, but we also look at your glucose levels, your sugar levels. And what we look at with the A1C is typically normal. There's a pre-diabetic range and then there's diabetes. So if we notice that you're in this pre-diabetic stage, we can give you lots of resources, education, and guidance so that you don't even reach becoming a diabetic in the first place. We can track and see that once we provide you with resources and education on how to modify your lifestyle, we have you come back, say in 3 months, to repeat that test. We can tell you like, hey, what you've been doing has been working because look, this number is now normal, or it's trending backwards, which is what we want, which is what we're hoping for. Or we can say, what you're trying is not really making a difference. There's something that's missing. We need to touch on something different because the number is still trending in the wrong direction. So it gives us time to create an effective treatment plan prior to something progressing in the direction that we don't want. Essentially, we give you the information. It's about us collecting the information, finding out what the data is, and giving it to you, sharing it with you, talking over it with you so that you can make the necessary changes if that's what you choose. There are a plethora. There are so many different treatment options. So we can talk about more conservative management, or we can talk about something a little bit more aggressive. During these visits, they're also important because you have an opportunity to ask your healthcare provider questions about your personal risk factors and seek guidance on topics such as mental health and tailored health topics that you are interested in. But I have to mention this. I would be remiss if I did not mention this. Who performs your wellness exam is important and can make a difference in your overall experience. Now, I will say this, getting your annual wellness exam done versus not getting it done is better than anything. But it just goes a long way when you have a healthcare provider who you truly believe is invested in your overall wellness, someone who you believe is caring and competent, and someone who understands the importance of meeting you where you are and treating you as an individual, and not just giving you a blanket generic treatment plan that they give to everybody. So let's touch on some of the many reasons I've heard over the years on why people don't get their annual wellness exams done. But I am curious, what are some of the reasons that you or somebody you know has not had an annual wellness exam in the last 2 to 3 years? What is the reason behind it? I'm interested to see if it will come up in the list that I'm about to provide you guys. So drop me a comment below. So the first reason that I typically see is that people honestly and genuinely forget to schedule it. And so in order to remedy this, in order to fix this, typically I advise people to schedule their annual wellness exam around an important date. So somebody that is very close to me typically schedules their annual wellness exam on the month of their birthday. It's something that they will remember every year, and they know that, okay, my birthday's coming up, I need to make sure I get my annual wellness exam. So they're tying it to something that's important that they know that they'll remember. For myself, I typically schedule it either around my birthday, or another thing that has worked for me is scheduling it at the top of every year or at the end of every year, so December or January. That typically gives me a 2-month time span to remember to get it done. So I've been erring on that side of getting it done in December or January every year, and I kind of frame it as I want to end the year being aware of what my current health status is, or I want to start my year knowing what my health status is so that I can make informed decisions about what my lifestyle needs to look like over the next couple of months. And just as a side note, so as someone who has worked in a primary care office, typically the summertime and the winter time are busier seasons for people getting their annual wellness exams. And that is simply because people are off from work more. They're taking more time off during the summers for vacations and just time off with the kids and just as a break in general. And at the end of the year, people have time off from their jobs for the holidays. So typically offices are flooded with people trying to get their annual wellness exams done. So just something to take into consideration. If you are going to choose the summer or the holiday season, schedule it months in advance so that you can solidify your spot. Reason number 2 that I hear is that I don't have a primary care doctor, and I think that's valid. Some people feel well, so they don't have a regular established relationship with a healthcare provider. For that, I typically recommend you don't have to have an established primary care doctor. You just need to get the annual wellness visit done. And so while it does make sense if you're going to do it routinely year after year to use the same provider, or at least the same provider's office, so that your records are not having to start from scratch each time with a new provider, I think it's helpful in that sense. However, if you do want to skip around from provider to provider every year, say you travel a lot or whatever the case may be, just make sure after you finish your annual wellness exam that you ask for the medical records of that visit, so you can take that to your next provider so they can start to keep up with what your trend has been, and they can look back at your past results. So you don't need to have an established relationship with a healthcare provider. You can still go and get it done. But I would recommend, since you don't have an established relationship, that you book your annual wellness visit months in advance, just to give yourself space to be able to get onto the books. I wouldn't try to schedule it for next week because they're typically really booked out. Reason number 3 is I don't like my primary care provider, and that's valid too. But I think if you are at a space where you no longer like your primary care provider, it's time to find a new one. And I think it's a beautiful opportunity to begin looking at the market and seeing what providers are accepting new patients. And I think an annual wellness visit is a great entry point, so they can get to meet you, see what your history is like, and see what your starting point is with them. But as I said before, if you're looking for someone new, if you're going to establish a new relationship, get your medical records from where you were prior and bring that to the new office. That history, those numbers, seeing your old lab work is important to us as providers. One of the more common things that I hear is, I feel fine, so why do I need to go get checked up? I'm feeling good. I'm not having any pains. I'm not having any issues. So once something pops up, then I'll go and get it done. And That's what we call perceived good health. It's perceived. You think that you have good health. However, there's nothing to solidify that. There's nothing that we can look at to verify that you are truly in good health. Because I have seen many patients who look fine, who feel fine, who we get their blood work back and it is not fine, okay? And there are things that you cannot see and you cannot feel yet, but that doesn't mean that there's not anything brewing beneath the surface. Like we talked about, early detection is what the name of the game is. That is what we want to see. So even if you feel good, even if you look good, you should still be getting your annual wellness exam every year. I had a patient one time, thin, petite woman of Asian descent, hadn't had a physical in quite some time, had one done. Her cholesterol levels were through the roof, and she was so shocked. But she did end up informing me that she had a family history of it, but that she felt fine, so she never really checked on it. But I'm glad that she did. I'm like, what's in the past is in the past. We're going to start from where we are today with the new information that we have now. So please don't let that be your reason for not going. Okay, reason number 5. I'm sure we can all identify with this, and that is, I'm so busy. A lot of us are busy. We are ripping and running, doing 1,000 things at once. Our minds are going a mile a minute on any given day. And I actually think that is more of a reason to get your annual wellness exam. If you trust me, I have been in healthcare for over a decade. When did I first start working as a nurse? That was 2010. Oh my gosh, I'm aging myself. But if you guys could see some of the things that I've seen over the years, if you do not make time for your wellness, your illness will force you to sit down. Your illness and your lack of feeling good, the symptoms that may start to surface will cause you to slow down by force. So you're either going to make time for it or it's going to make time for you. And honestly, sometimes people who are so busy are often not taking care of themselves right. They're typically eating out a lot. They're typically not working out. They're typically stressed. So they're actually at a higher risk for developing a lot of health conditions. So like I said, I think that these category of people, if that's what you're using as your reason, I think it's actually more important for you to make sure that you prioritize getting your annual wellness visit. Another really valid reason is I don't have insurance, or I have insurance but I have a high copay or a high deductible. Finances are important. Who's paying for this exam? I would say if you are looking at that, if you're facing that, number one, I think that being strategic about making sure that you're saving for this. It's on an annual basis, so you have 11 months out of the year to maybe save in smaller portions so that you have enough money every year when it comes around to be able to pay for it. If you don't have insurance that's paying for it. Also, if you just don't have insurance at all and the cash price is too expensive for you, I would recommend that you get on Google, type in the name of your city, followed by Health and Human Services. Typically, that resource will direct you in certain ways where there are offices or programs available that can help you out and assist you. They can definitely point you in the right direction. So for instance, if you live in Houston, type in Houston Health and Human Services and try to find a contact number or somebody that you can get on the line with, or even a good email address. So hopefully that helps you. Something that is frustrating, but also a very valid reason, is the inconvenience sometimes associated with booking the appointment. Like I mentioned earlier, I would not try to get an annual wellness exam next week because the likelihood of there being an opening is slim. It's not impossible. When I was a healthcare provider and I was seeing patients, I would be booked out 2 to 3 months in advance, if not longer. And sometimes the reason for the wellness visits being so hard to come by, I wouldn't say hard to come by, but not as easy to get as a regular visit, is because annual wellness exams take more time. And so they take up a bigger time block on the schedule. So we're not doing numerous lots of annual wellness exams in one day. We are typically limited to a certain number of wellness visits per day, and so that can make the scheduling push out further for people who are looking for those appointments. But don't let that deter you. The remedy for that is to book your annual wellness visit in advance. Book it 3 to 4 months in advance to be on the safe side. With certain providers that are really good, really popular, or maybe have limited scheduling to start with, then I would even book out, closer to 6 months in advance. Another helpful hint, though, what I typically do when I go in for my annual wellness visit, at that appointment, I book my next one. So I typically book mine a year in advance. I can always tweak it if I need to as the days and the months get closer. But typically, like I said, if I'm sticking to a schedule of a month, a specific month that I want to get it done in, I can book it in advance and tweak it if I need to. But at least I know I have something on the books. Another thing that I've heard in the past from patients is I don't have reliable transportation to be able to get to my appointment, or I don't have someone who can drop me off and then come and pick me back up again, or I don't have a car in general. Plus, coupled with the fact that sometimes, as you guys may or may not know, when you go to see your primary care provider, the wait time can be long. There's no sugarcoating it. Sometimes people are sitting there, depending on the office, anywhere from 15 minutes to an hour waiting for their appointment to start. That is extremely unfortunate, but there are so many things that can come up in the course of a day, emergencies, and things that providers need to tend to, that sometimes there is a bit of a wait. And some people, because say they do have someone that can pick them up at this time and this time, there's not much wiggle room in that for things to flow over by that much of a margin. And for that, I really think that you have to get creative to your personal situation, whether it's depending on your age and everything. There's so many different factors to take into consideration. So you really do have to look at your personal situation. But if you are on the younger side and you can do something like, depending on the distance of where the location for the appointment is too. There's so many different factors, but I've had people Uber to appointments and Uber back, or Uber, Lyft, whatever ride share you prefer. I've had people use taxis. They're old school, but it works. I've had some people take the bus. I've had people ask a neighbor instead of a family member that may be too busy. And then, like I said before, depending on your age, you may have transportation benefits as part of your insurance. So that's something that you can look into. But again, I think by utilizing the Health and Human Services resource for your city, I think they may be able to guide you in some ways to help fix this issue for you as well, because getting to the appointment is key. And last but not least, I think it's something that people don't necessarily think too much about, but it is something that I've had come up over the years. And that is, I'm scared to get bad news. I'm anxious about the process. I'm anxious that they may find something, or I'm hesitant because I had a bad experience with a healthcare provider in the past. And so that has caused me to kind of stay away from the medical field and all healthcare professionals in general. And I think that's extremely valid. But I would also say, don't let one bad experience or two bad experiences or multiple bad experiences take you away from owning your healthcare journey. I think it really is about finding a provider that is a good fit for you and what your values are. And so I think a way to find a provider that is in alignment with you is, if you have people around you that like their provider, start getting word of mouth referrals. And I think maybe instead of starting your first visit being your annual wellness exam, maybe you go in for just a routine visit. Those are typically 15-minute slots, and say, I just want to meet the provider. It can be a short and sweet introduction where you can kind of talk to them, let them know what your perspectives and desires and viewpoints are, and see if they're in alignment with it, and kind of go from that standpoint. Also, another way that you can find a good provider if you're not liking yours or you had bad experiences in the past is you can look up reviews online. Typically, Google has reviews. There are reviews on Yelp for healthcare providers. There are reviews on insurance company websites. So I definitely would utilize that as a resource as well. Sometimes you have to go through a few providers to find your perfect fit or to find the best fit for you. And I think it's well worth the investment of going through that trial and error. So we've said a lot today. I hope this video has been helpful for you, and I hope that this will help to ultimately get you to get your annual wellness visit scheduled and on your calendar. So until the next video, but before we head out, If you have any questions, if I did not touch on something, if you want to add anything to the conversation, be respectful and drop it below in the comments below. As always, if you like this video, feel free to click the thumbs up button. It really does go a long way in helping me to grow my channel here on YouTube, as well as hitting the subscribe button. That button helps you to become a member of my community here on YouTube and to continue getting great videos like this one. As you guys know, I look at healthcare from many different lenses, and so I am here to bring all types of wonderful content to you. I want you to know that you are important and you deserve to be healthy. So thank you again for taking the time to watch this video to support my channel. Until next time.